Hello, my name is Dr. Michael Mack. I'm one of the residents here in the University of Calgary, here to explain to you Vitreoretinal Training C, Epiretinal membranes level 4. In this particular level, your job is to remove the extramacular epiretinal membranes that are located along the vascular arcades. So this level here is very tricky, and I'm going to sort of highlight a couple of things that I thought was helpful in regards to completion of this level. The first is that, as you notice here, I'm starting with the smaller um, epiretinal membranes first, and it's very adherent to the retina. So you have to be careful not to pull too hard or too quickly, and then the system will detect that as actually um, ripping or shearing the retina off and causing a retinal tear. It's particularly noticeable when you try to remove the larger epiretinal membrane, um, and so that's something that you can imagine will give you a lower score. So here, if you notice, I'm starting kind of in the middle of the membrane, not at the edge like you would for rhexis, and then I'm kind of peeling out. I don't think that this is very standard fare on how you would approach a membrane in real life that would be tractional in nature, but it is something that you can consider because I find that when you're scrolling and scrolling too much on the edge, the system may detect too much traction and then also deduct you points, or you may cause a retinal tear that you'll have to laser. So you notice here it's like a couple of times you're trying your best to peel and peel, but then you're still having a really hard time with that last part. So what I recommend is that you try to remove what you can. Some of it is still stuck there. Bring it into the middle of the vitreous, and the gravity doesn't really work in this level, so it will stay suspended in the vitreous cavity. So here you notice that I'm using the cutter with a high cut rate and a relatively lower aspiration, just so that you're not pulling too hard on the retina that may be still attached, and then you clear things up a little bit more. Then you can go again and then try again with your forceps to peel off the remaining edge. So that's what I feel is the most efficient, going through the smaller ones first, bringing the pieces of the membrane into the vitreous, and then using the cutter to remove it. And if you don't remove it with the cutter, then you will actually fail the level because it would register as not having the membrane removed. So here we're doing this again. The membrane at the bottom is a little bit larger this time, and so I am going at the edge and then sort of peeling at it. You see there's an area there that has a higher traction to the retina, so you have to be careful not to pull too hard. You may want to try to pull more tangentially. That will reduce the amount of force that you're exerting directly anterior-posterior that will cause a retinal tear. So again here, almost like you're doing a rhexis in cataract surgery, you want to be able to peel some of those membranes away like that. Similar here. At the very edge, you want to peel. You notice for the bottom one, I did try to roll it all into one nice rhexis, one nice little ball of membrane, so that it's much easier to aspirate with the cutter. So again, very much like a rhexis, you want to be able to pull in almost like a circular-like fashion. Almost at the edge of the rhexis as well. You may have to adjust your camera um, or your scope appropriately to where you best visualize this. I am operating at a very high magnification, the highest that I can, in order to perform this task. These smaller ones are pretty relatively straightforward on this level, but in other levels where you do have these small epiretinal membranes, you want to be considerate and potentially avoid pulling too hard like I did there, because if it's really sticky, it will cause a retinal tear. So you try to judge it based on um, how the tissue underneath is behaving, and then stop if you're noticing that the retina is puckering a bit too much. Here I'm using, again, relatively high cut rate, lower vacuum. So we scored 99 in both levels. Thank you very much for watching. Please like and subscribe for more.